Hi, welcome. I am Dr. Laura at Backcountry Health. I'm here today to talk about chiropractic and pregnancy. So for that, I brought in a very pregnant model. Just kidding, I have myself. I'm 6 months pregnant right now. The first thing I want to cover is chiropractic and safety during pregnancy. Yes, chiropractic is really safe during pregnancy. We work hands-on, we work to your muscle tolerance. When we're doing like myofascial soft tissue release, we can typically adjust really gently. When you're pregnant, you have more relaxin in your body, which is a hormone that helps the ligaments relax so joints move easier, so you're much easier to adjust. Typically, you do need adjusting more often as well because joints move much more often during pregnancy. We also have some cool tools that allow you to lay in your stomach during pregnancy. Both of our tables have this drop-down piece that drops down to allow room for your stomach, as well as these pregnancy pillows that have a cutout, and we can layer one or two of them on top of where the table drops to allow room for you to lay down with no pressure at all on your belly. And it is so nice to be able to lay in your stomach, even if it's so nice to be able to lay in your stomach, even if it's just for a short amount of time while you're pregnant. Running into what are the most common areas of pregnancy pain, what can we do about it, and when is it time for you to see someone else? So one of the most common areas of pregnancy pain is low back pain. So we're looking right here, lower spine. This is your sacrum where your spine attaches to your pelvis. As I mentioned, during pregnancy, you have more relaxin in your body. That usually kicks in around month 5 of pregnancy. And what that does, that allows the joints to stretch out, right? You're gonna want the pelvis to widen. That allows more room for the baby to fit in there and then later to come out. So you can get low back pain either right at the SI joint where your pelvis is attaching to the sacrum. That joint can shift a little bit, or you can get it right in your low back, and that's usually related to pregnancy weight gain, right? All of a sudden you have this anterior weight pulling you forward. You don't have the abs that you might have had before, and your back muscles are working a lot harder to hold everything together. You can get kind of a steeper curve through your low back as well, and vertebra can kind of crunch down on top of each other. Sometimes people have pregnancy-related sciatic pain, and that's when you have nerve pain. Comes out of the low back, runs down back of your leg, sometimes into your lower leg as well. And so all of that responds really well both to chiropractic care in terms of adjusting as well as soft tissue work. One thing to think about, everyone's like, oh, pregnancy, you must be so relaxed. You have relaxin. Relaxin, what it does is it relaxes the ligaments. It does not relax the muscles. So often your muscles are working overtime trying to hold everything together as your joints get stretched out. So depending on tolerance, we do active release technique here. Cupping is also super nice when you're pregnant, and that can be a way to work through those muscle knots without compressing into them and causing more pain. Moving up in the spine, another area where pregnant women commonly get pain will be neck and shoulders, right? You also have more weight gain in the breast tissue, pulls your shoulders forward. We see this a lot postpartum as well. And so you get pain kind of behind the shoulder blades where the ribs are, and then top of the shoulder blades as well. You can get kind of pulled where the spine gets pulled into flexion here because we're kind of sitting forward. And so a nice adjustment that helps you move back into extension can help a lot with the pain, as well as muscle work between the shoulder blades and on these knots on the top of your shoulders. Last area that I'm going to talk about, neck pain and headaches. This is something that happens to me a lot during pregnancy, and it's just that your anterior chain of muscles, they're not firing as well. So your posterior chain is kicking in hardcore to hold you upright. And so even if it's, it's your low back and this area that's doing a lot of the work, often that's pulling at the base of your skull and can be causing headaches there. So that's a lot of things that we can work on in the office, but there's a lot of things that are similar where I would send you somewhere else. So especially first trimester, you can get headaches, and those are related to your blood volume doubling. And it's kind of like an altitude headache where your body's trying to make enough red blood cells to fulfill that. And those headaches, we can't do anything about chiropractic wise. I know that from personal experience, I saw an acupuncturist first trimester, and I love that, and I would recommend that. Another area where females typically get pain during pregnancy is right here at the pubic symphysis. And again, that's because the joints are relaxing and that symphysis can start to open and it can become unstable. We can do some in terms of adjusting the SI joint, right? It's a circle, it kind of goes around, and sometimes adjusting the back can help in the front. We can lightly adjust that area, but this is where I would have you see a pelvic floor PT, because they can give you the strengthening exercises to hold that area together better and decrease pain. So reach out if you have any more questions. I'm happy to talk to you about chiropractic and pregnancy. I know a lot about both. Tyler's comfortable working with pregnant women. Obviously, he works on me, and we'd love to see you and help you through this time.